So this is a recording for the Occupational English Test, and the test is held at MedCity International Academy, Kannur on 7th October 2022. The candidate's name is Henna Sharma and the candidate number is 8462. The interlocutor is Sangeeta Gopi and the interlocutor number is 4646. This is role play number 1 for the profession of nursing. Good morning, Henna.
Good morning.
May I see your identification, please?
Yes.
Okay. Right, thank you. Henna, remember, this is a test of your English language and not an assessment of your professional knowledge. Keep that in mind. Speak as you would naturally.
Okay.
We will move on to a warm-up session to get you started. This is not in any way assessed.
All right.
Okay. Why did you choose nursing?
Choosing nursing was not actually my choice. It was my parents. They wanted me to take up this profession. But later on, I started loving this once I got into my job.
Okay. And do you have a role model?
Well, that is one of my seniors. She made me love this profession. She taught me a lot of things, how to deal with people, how to accept the reality and everything. Yeah.
What are your future plans?
Well, to clear this test and to get settled in a European country, probably UK.
Okay. All right. So, Henna, let's move on to the role play now. I'll be taking the part of the patient and you take your professional role. The role play will last a total of 5 minutes and you will be given 3 minutes to prepare for the same.
Okay.
The role play intends to get evidence of your ability to perform effective communication with patients. Do you have any questions?
No.
Okay. So you'll have 3 minutes to prepare. You can make notes on the role play card if you wish to do so. So here is a pencil. This is your card.
Thank you.
So you can look at the card during the test, but you must return it to me at the end of the test.
All right.
You may start your preparations now.
Okay.
Hannah, that's the end of your preparation time. You now have 5 minutes for the role play card.
Okay. Good morning.
Good morning.
I'm Henna Sharma, the nurse on duty here.
Okay.
How may I help you?
Well, I'm here, Hannah, to meet the doctor. I have some problems that I would like to discuss with the doctor. So, can you please make arrangements for that?
Sure. Please take your seat.
Thank you so much.
How may I address you?
You can call me Sangeeta.
Okay, Sangeeta. So, Miss Sangeeta, could you please state the reason for the visit?
Well, like I said, I do have a couple of problems. Like, I've noticed that for quite a few months I've been suffering from wheezing. It's very
Wheezing.
difficult for me to breathe and it gets really tough at times. And I also think that I have some problem with my throat, especially while swallowing stuff. So I think it's a serious medical condition. I want to consult a doctor soon.
Okay. Could you please state your age?
Yes, I'm 35.
Okay. Well, now that you've mentioned the throat problem, is it persistent or is it like episodic?
Well, to be honest, I don't think I've noticed that much. Maybe it was there for quite a long time, but it is just recent that I noticed that I have this throat issue. I was just Googling stuff and I found something on the internet that you might have, something, maybe a cancer related condition there. There might be growths there. I'm really concerned about that.
Okay. Well, do you do anything like a treatment by yourself? Any medicines over the counter?
No, I did actually try some. I mean, trying to look for some, but no, I went to another doctor. But the doctor checked and said, I'm all right, there's nothing serious, but I know there is something wrong with me.
You want a confirmation?
Yes, that's
Okay.
right.
Miss Sangeeta, well done for seeking medical help.
Thank you.
MedCity OET app. Learn OET listening, reading, writing, speaking, and OET related grammar at your own convenience. Download the app now.
Can I please examine you?
Yeah, sure.
Okay. Well, you seem to be fine, physically fit, but what exactly makes you think that there is something off?
See, now this is not right, Henna. I already told you I Googled stuff, I found some information on the internet.
Okay.
Like I said, I've met a doctor before. Now you examine me and you say, I look physically fine when I am not. Like I said, I do have difficulty swallowing. I already have this wheezing issue. I'm sure there's something seriously wrong with
Okay.
me. I want to see a doctor right now.
Of course, you can meet the doctor. He's busy at the moment. He will meet you in a short period.
Yeah, please let him know that I'm here. See, I know this is something really serious. I'm sure the doctor will find that out.
Of course, he will. Miss Sangeeta, my intention was not to offend you, but I just wanted to confirm. You said there is throat problem and some wheezing.
Yes.
Other than that, is there any other problems?
Well, lots and lots. Like I've noticed I have these stomach cramps. I'm not sure if it is related to food or something, but not that. I think there's something seriously wrong. Like I feel weak at times. I feel it's really difficult to breathe. Like I said, I have wheezing already. I think an endoscopy might be required to check probably what's wrong with my stomach.
Okay, that we need to find out after the
Yeah.
consultation.
Yes, that's right. You hear all sort of stuff these days about medical conditions, being late to recognize them, and you're dying of that condition. I don't want that to happen. So I want to seek medical help as soon as possible.
I do understand your point. But let me tell you one thing. Sometimes we might feel that there is something wrong with us. That can be some assumptions. I'm not saying that you're wrong here. I'm not doubting you. But I'm just saying maybe we might misinterpret the symptoms that we have.
So are you trying to tell me that there's nothing wrong with me and these are just my fantasies that I have physical problems?
No,
Then?
that's not my intention. I'm just trying to tell you this is also a possibility.
I'm sure only the doctor will understand.
Obviously.
That's why I said in the beginning that please call a doctor. I want to see a doctor right now.
Obviously, I'll make arrangements for that.
Yes.
Is there something else that you want to ask me?
Well, nothing. I'm like I said, I've seen a couple of doctors before. I'm not really happy with what they suggest or what they tell me about my conditions. And I've heard good things about the hospital here and the doctor here. And that is why I'm here to meet the doctor.
Okay, so all the symptoms that you have explained, does it appear all at once?
Not really. The wheezing and breathing difficulties happen together, of course, yes. Stomach cramps, and when I have the breathing difficulties, I also feel really tired, like I'm unable to do a lot of things.
Okay.
Yeah. So stomach cramps, yeah, maybe not connected with this, yeah.
And you have been experiencing this since?
Yes. Quite some time, maybe over a couple of months now, maybe 4 or 5.
Okay, and you have already.
Yeah, consulted a doctor.
Consulted a
yeah.
doctor,
That's
okay.
True, that's true.
So I'll make the arrangements for the consultation. You have to wait here for a couple of minutes more. Is that okay?
That's okay, but I want to see a doctor because I'm sure he'll be able to understand me better.
And you said that you have already consulted the doctor.
Yeah, that's right.
Okay. I'll make arrangements for the consultation.
All right, Henna. Thank you. That's the end of your speaking time. Download MedCity OET app, available on Play Store and App Store.